Tennessee Department of Health is asking for more information about Ballad Health's proposal to consolidate neonatal intensive care services.
Ballad unveiled its plan about a month ago, saying it would improve the quality of pediatric care in the region. While the Tennessee Department of Health already approved Ballad's plan to realign trauma care services, the department's approval is still needed before Ballad can move forward with another big change. The company believes it's best to close the neonatal intensive care unit at Holston Valley Medical Center in Kingsport and provide all NICU care at the Niswonger Children's Hospital in Johnson City. The state has 90 days starting last month, or had 90 days starting last month, to rule on that request. But in a letter addressed to Ballad Health CEO Alan Levine, the state outlines more than a dozen areas where it believes Ballad needs to provide more information. The letter said information provided by Ballad to the state currently is, quote, general in nature and without a sufficient level of detail or specificity. Jackie DeFusco is in your corner with more on the department's decision.
Well, Josh, the Tennessee Department of Health continues to hear from people both for and against Ballad's plan. I recently had the chance to review more than 40 letters to the state from the public opposing Ballad's NICU consolidation plan specifically. But today, the dean of the ETSU's College of Medicine told me he's convinced Ballad's plan is best.
The idea that the staff and the unit is already there and so it should just continue ignores the idea that we can improve outcomes by consolidation.
Today, the dean of the region's only medical school defending Ballad Health's plan to consolidate NICU care.
Duplication of services is more costly and has worse outcomes. Then there's no reason to continue just based on a 20-minute drive.
But longer travel times resulting from Ballad's changes is among the public's biggest concerns.
I do admit there are a few patients that have that as a barrier.
He says there's been talk of facility upgrades that would allow more moms to stay in rooms on site.
Certainly, there needs to be some infrastructure investment.
But many members of the public are worried that Ballad Health and their supporters are only concerned with making money.
We're not improving our financial picture by any of this support. If anything, we're harming it, because playing the two hospital systems off of each other allowed us an opportunity to negotiate stronger contracts.
Dr. Block says NICU consolidation is an opportunity, in part to hire 10 new pediatric subspecialties that will add to Niswonger's foundation.
We have all of the subspecialists that are involved in creation of an NICU care team that really was never built out and supported at the Holston Valley Hospital.
And to increase volumes, a recommendation he says is in line with the American Academy of Pediatrics recommendations for improving patient outcomes.
I understand that individuals have had great outcomes for some babies coming out of that unit, and that's a wonderful thing. They're going to have even better outcomes if we allow the system to work and consolidate in a manner that puts the patients first.
Now, I did reach out to the American Academy of Pediatrics asking them to elaborate on their NICU policy recommendations. The AAP declined several interview requests, saying the report speaks for itself. Well, that report cites studies that suggest caution in using volume as an effective indicator of quality of care. That full report will be on our website, WJHL.com.
Jackie, thank you. Now, once the state has all the additional information it wants from Ballad, that 90-day review period will begin. Late today, Ballad Health issued a statement in response to the department's delay. A Ballad spokesman said, quote, "The Tennessee Department of Health's request is an expected part of the state's due diligence for proposed actions that require state approval. We are in the process," Ballad said, "of preparing our response," end quote.